Hi, I'm Dr. Brian Thornburg. When should you start solids in a baby? Typically it's around 6 months old, but you can go a little bit past that. The reason I say this is that the baby has to have certain developmental milestones in order to start to eat solid foods. First, they have to be able to sit up, which means that they have to have some core strength. So when you put them in the high chair, you want to make sure that they're sitting up and they're using their own power to sit up and that they're not a little bit floppy still here in the midline, because you can see sometimes around 6 months they still wobble over once you sit them down, or they'll tripod. So it's really important that they have core strength because you want them able to sit up and not kind of slouch over. That's not good for the hips, it's not good for the posture, not good for the back of the neck. Secondly, you want to make sure that the tongue thrust is stopped. So prior to 6 months, the baby sticks their tongue out kind of reflexively. If they're still doing that at 6 months, and if you put a spoonful of food into their mouth, they're just going to push the food back out and off their mouth, and it's just going to make a mess. They're not eating very effectively. And the last is that they have to show an interest, because you'll notice right around 6 months, they'll start to look at your plate and they'll see you put the food on your fork, and then you'll take it to your mouth and they'll literally just watch you go back and forth. And so you have to have those three elements in order for a child to start solid food. I also mentioned that they could start solid food after 7 months. There's no reason that you have to start solid foods at 6 months. It's something that parents like to do, especially with first children. But once you have more children, you don't start at 6 months. At least I did. The baby can grow adequately with just formula. Hope you find this information useful, and hit that like button.